states are now reporting an increased number of cyclosporiasis cases compared to previous years. Many of those cases are linked to lettuce served at Taco Bell restaurants across the Midwest. Steve is down in the ARC Lounge with Washington State's Health Secretary Dennis Worsham. Steve.
Yeah, Patrick, and we just learned from the CDC this morning that this is now expanded to 4 more states here in the U.S. And I think the big question, Secretary, is for people living in Washington, how worried should we be about this?
Yeah, it's a great question. Right now, we're doing all the investigations of cases that we see here in the state of Washington. We have a very low number here.
Okay.
We're in the 30s.
Okay.
And there have been no links so far to the larger outbreak that we're seeing in the 9 other states.
So when you're looking at something like this, which has obviously impacted a number of other states across the country, and we're certainly seeing some here in Washington too, how do you monitor this? How does DOH sort of look at this and sort of figure out a plan if indeed it does creep a little bit more into Washington State? What are you doing here?
Yeah, well, a couple things that we do just from a natural area of public health when we're doing this work. Every time we have a case, we investigate it by having conversations of where you've eaten and try to find all the links. We work very closely with our other state partners and with the federal government, CDC, and to make sure we understand where the links are. And we are trying to do as many preventative things as recalls if there are any supply chains that are delivering those foods here into the state of Washington.
And we were talking during the commercial break with some of your staff that's here with us this morning about eating produce or lettuce in particular. Yeah. So for people that are going to the grocery store, is it still safe to eat? Should there be any concerns there?
Yeah, it's always a good practice, right, is to wash fresh produce that comes in. These parasites really come from oftentimes where the food is grown and the supply chain that brings them into those areas. So the good practice is you can wash those things before you come in, and those vegetables, leafy vegetables, iceberg lettuce, wash them before you eat them is a good practice regardless.
And what is the good practice? Is there a certain length of time that we should be doing that for?
Yeah,
generally?
it's this parasite in particular it's just really small and you can't see it, and so to be able to run it under your faucet for a couple seconds and making sure if you're breaking lettuce off is to watch each leaf is a good practice.
Okay, and I think another question that a lot of people are having is, can you get this from a person? How does this spread from one place to the next?
Yeah, this parasite lives on vegetables and fruits that are grown, and they are not exposed from person to person. So it is from a source of food that you eat.
For people watching at home who maybe is looking at the cases that have been popping up in other states, what do you think is the biggest takeaway for them in terms of the concern level or what they should do in their day-to-day practice?
Yeah, what I oftentimes will say is the good practice if you need to wash your fruits and vegetables as you bring them into your home. The other part is really pay attention to when there are recalls. And we put those out there through the media, through social media, and pay attention to what those recalls are and really listen to them. The thing that I would want people to know that's so important here is, one, it's treatable. It's medications that people are able to do it. We've had it before. It isn't the first time we're seeing it. We have cases, probably about 2,000 cases a year across the United States.
Okay.
And we have about 4,000 now through this outbreak.
And is there things that we're learning maybe as more cases spread across the country about this that maybe we didn't know before?
Well, not really.
Okay.
Not really. So it's really about, it's a fecal matter that shows up in the watering or the water sources that really water fruits and vegetables and leafy things like lettuce and herbs and other things. We know where it comes from, and when you start to see people getting sick, you go back to the source of where it's being grown or where the supply chains are to interrupt that particular part of it.
And for people that maybe have not been following this, are you able to tell us what happens with this? Like, what are some of the symptoms in people?
Yeah, so it's watery diarrhea for a long extended period of time, stomach cramps, and really encouraging people that if you are having a long period of diarrhea, a few days that's not clearing up, is don't wait it out. Is call your doctor. It's treatable. It's get the relief you need, but don't wait given the context of what we're seeing.
All right, it might be urgent to go see a doctor at that point and figure out what's going on. Thank you for sort of putting us at ease for now, but certainly something that we're watching across the country. Patrick?
All right, Steve, thank you. That's critical information. We appreciate that.